Hi, I'm Dr. Michael Gartner. So today I've been asked to do a celebrity analysis on Kim Kardashian. We do celebrity analyses because for my regular patients, they're always asking me, how do I stay younger and look like celebrities? Well, majority of these celebrities spend an incredible investment in making themselves younger, and that's part of their business and how they make money. Well, let's go over what Kim Kardashian has done with herself, potentially. The first pictures of her are around 27. Now, if you compare her at 27 from earlier years, I suspect she's had a rhinoplasty done because the hump of her nose is much less than it was years ago. And the humps usually get larger as you go older, they don't get smaller. So she did maintain some of her ethnicity by keeping a little bit of a hump there. I also believe she's had breast augmentation. So breast augmentation is something that commonly happens around 25. I think both were very tastefully done at this time. If we move on to where she's 28, I'd have to say her cheeks look a little fuller. So I suspect a couple things possibly happened here. She might have had cheek implants, or she may have fillers done, or possibly a filler called Sculptra, which is a material that usually lasts 2 years before it dissolves away. I think also very tastefully done. Now, along the way, she's had Botox treatments. She has no wrinkles on her face. Her skin shines. I think she's had great skincare, and she's also had some energy-based non-invasive treatments which she's invested in. These things make your skin look younger and can help improve lines and wrinkles, especially with Botox and fillers. Around the age here of 29, it looks like she's had some filler to her lip. She has a little bit of a lip flip there when she's starting it. And if you look at her younger years, her upper lip looks a little smaller. So as we age, the upper lip gets smaller, it doesn't get larger. So hers got larger with age. So I suspect she's had a little bit of a filler here. So now we're moving on to roughly around age 30. I don't really see too many changes with these pictures here. Now we're moving on to age 31 in 2011. I don't really see much happening here either. Now in 2012, around 32, some of the pictures to me look like her waist got smaller and her hips got rounder. So I believe she got her waist snatched, possibly with liposuction, and then had some of that fat grafted in her buttocks and along the sides. To get that roundness that she didn't have when she was younger takes a lot of fat. So she may have had some Sculptra treatments as well in this area. Age 33 in 2013, her tip of her nose looks more refined and it's slightly upward in rotation. So I believe she's had a revision rhinoplasty done. Once again, very tastefully done, I believe. In 2014, her forehead looks rounder. She used to have a little bit of a widow's peak, but now that's filled in. I suspect that she probably had a hair transplant done at that time. 2015 at age 35, I don't really see much going on here. 2016, age 36, more the same. 2017 at age 37, don't really see much changes throughout these years. Like I mentioned previously, she's obviously been getting great skincare, non-invasive energy-based treatments for her skin to keep it tight. Around 2019, something interesting. I noticed that the distance between her nose and her lip is a little bit smaller, and she's showing a little bit more of a red of her lip. Now that could be from filler, but I also believe she's had a lip lift. A lip lift is an incision underneath the nose, which takes a small amount of skin out to lift up the lip because the lip sags as we age and covers the teeth more. If you can see, she has a little bit more teeth show. So I suspect she's probably had a lip lift at that time. Now in 2020, at age 40, I don't really see too much going on there. At 41, she's looking a little more sculpted. I believe she's possibly had an endoscopic facelift and possibly buccal fat pad removal. Now we're moving on to 42, and you can see she has that really sculpted look there. I think she's getting a little more filler to her lips. Her lips are looking a little more even, which, once again, the upper lip gets smaller as we age. It doesn't get larger. And now at age 43, you can see her shapes enhanced. I don't see much going on there at 43. And then up to date here in 2024, I don't really see many changes, but I think she's had great procedures. I think she's had great results. And I think it was very tastefully done. But I think she's investing a lot in keeping herself look young and youthful. And why not? She can afford to do it. And, that's how she makes money. If you're interested in any of these procedures and what can make you more youthful, I would entertain you to give me a call and set up a consult, and we can go over these things and develop a plan. Hope to see you soon.